And we did hope that you all get educated. That is the impact of coronavirus on Ghana's hospitality industry. And we went to Kempiski. And I'm sure that our business team had to take a lot of time and also making sure that the precautions are well managed. Well, as we also move on, we have to look at the impact on the environment as well as related issues of how a newfound drug that has been experimented on a number of patients in the UK could be the real game changer, or is it not? Right here in the tropics, we're talking Africa and the rest of the rainy weather areas. There's a big question in the scientific community about all these drugs that are being experimented, and then also the environment we find ourselves, and especially looking at the rainy season, how it has an impact on coronavirus, its treatment, and then the related sanitary or sanitation problems we have right here in Ghana. So we're here to look at it in our next assessment. We'll be right back. And then when we come back, we'll have all the relevant discussions on Zoom. And we will be introducing Professor Simon Mariwa. He is a health and development geographer. And is joining us live. Good morning to you, Professor Mariwa. If you can hear me, Professor Mariwa. Please, all of you, make sure you unmute.
Yes.
You unmute.
Good morning.
Yes, unmute your sounds, the three of you. Dr. Kofi Mega is head Department of Clinical Nutrition and Dietetics, and so is also joining us. Dr. Mega? Let me see. Morning.
Good morning, sir.
Yeah, morning, Doc. And then I also
hope
have
you are well.
Charlie. We did good. We did good. I've read a number of your instructive articles and pieces, and quite revealing. We seem to have all the right, all the right scientists, immunologists, virologists, dietitians, and clinical people right here in our country, and we have aggregated some of the best ones we have right here today for this discussion. And Dr. Samuel Esiembedu, and instructively, he's a regular contributor on coronavirus since the season started right here on the show. And again, Dr. Samuel Esiembedu, we say thank you for joining us. He is a virologist as well as a microbiologist by way of practice. He has trained extensively in where the virus itself started in China, and so knows a lot about, you know, the topography of the areas, and we're in to do a good discussion. And myself, since I got this topic that I needed to do this, I had a lot of reading to do, and so I have some questions on mind. But let me first start with you, Dr. Kofi Mega. Our environment, the environment that we have, this wet environment, the tropical environment that we have, what is that correlation of a rainy season and coronavirus? Instructively, just to start with.
Okay, so I think what is instructive to note is that these viruses and other pathogens are affected by temperature, humidity, rainfall, I mean, largely by weather variables, climatic variables. And there's a lot of empirical evidence that suggests that, I mean, whether the temperatures are becoming higher or lower, these pathogens can thrive. You know, so now, as it relates to COVID-19, there is some emerging evidence that is coming that suggests that as the temperature levels start to increase, then of course, we are going to see a significant decrease in the number of COVID cases. So in our settings here, where with the onset of rains, it's expected that the temperature levels are going to be lower. So once temperature levels are going to be lower, then the viruses are going to thrive. So it is anticipated that we are going to see an increase in the cases with the onset of the rains.
Professor Mariwa, if we take a look at the related issues that the rainy season tends to pose, that also means that this has added an additional burden, so to speak. Apart from the rainy season, we also tend to have poor in sanitary conditions. How does that then complicate the issue in the first place?
All right, thank you very much. Roland, I think it's very interesting to have such a discussion on a prominent channel like JoyNews. First of all, I would like to indicate that we look at the sanitation conditions in Ghana. We are talking about a situation where about 22% of Ghanaians are practicing open defecation. And when we're talking of open defecation, it means that people do not have access to toilet facilities, and for that matter, they, as it were, do it in the open. You're talking about on beaches, in the bushes, and all of that. And we know that about 60 to 70% of OPD cases in our hospitals are related to poor environmental sanitation. I mean, poor waste management, poor toilet facilities that people do not have, and all of that. So what it means here is that with sanitation being that poor and COVID in our midst, people's health are going to be compromised. I mean, we are talking about if people are suffering from sanitation-related diseases, it's going to compromise their immune systems. And we know that COVID tries very well when people's immune systems are compromised. So with poor sanitation and high prevalence of poor sanitation related diseases, here we are talking about cholera, diarrhea, typhoid, dysentery, and all kinds of diseases that are related to poor environmental sanitation. And with the coming of the rainy season, we are going to have a very challenging capacity of our waste management institutions to deal with the waste that we have, because we have poor road networks that are leading to the final disposable sites of the country. So if you look at final disposal sites of most of our communities, mostly in our cities, the roads are so bad that during rainy season, we have high breakdown of vehicles that are transporting this waste into the site. And for that matter, there's going to be reduced capacity for most of these waste management companies to collect and dispose of waste. It means you're going to see more waste on our streets. And as you know, anytime we have rainy season, we have a lot of flooding. And when we have flooding, we have increase in cholera outbreak in the country. And for that matter, people's immune system are going to be compromised. And for that matter, COVID will take undue advantage of the situation and deal with the country the way we have never seen before. And for that matter, there's a need to understand and appreciate that the rainy season is going to pose an extra challenge with compromised immune systems resulting from poor environmental sanitation in the country.
And Dr. Siembedu, already we've seen the rains, the floods in Accra. And if you take what the figures are as posted by the Ghana Health Service, it is in Greater Accra that we have the most cases. What should we be afraid of, because the cases are now not only coming from the communities but also being reported widely at the hospitals?
Absolutely, Roland. I think that Professor Maiwa and Dr. Mega have clearly indicated what we need to look at, particularly in this rainy season. So there are two key indicators here in terms of what we need to do: the sanitation aspect, and then the challenge that our healthcare system is likely to face. Because if you have increased number of people suffering from sanitation-related diseases, then of course that is also going to put a lot of pressure on the healthcare system. Again, there is that compromise in immunity, as Prof. rightly said, commonality of infections that people are likely to suffer and all of that. So our numbers are going to go up if we are unable to attend to these two major things, particularly how we deal with our waste, how we deal with issues of insanitary conditions, especially in the capital and then some of the bigger cities. And then the challenge of hospitalization or frequency of people to the hospital is something we need to look at, particularly in this time.
Dr. Mega, when it comes to our nutrition and the status of the population's nutritional levels, how good or bad is it in the first place, even prior to the onset of the rainy season or the wet season?
Yeah, that's a good question. The president has been admonishing us to improve our nutritional status by eating well, eating local foods. All this is an attempt to stimulate immune response. We have Dr. Simbedu here, who is an immunologist and an authority on the area and can best speak to that. So basically, when you have your nutrition is that good, you're going to have improved immunity. And this is what is going to fight against the viruses. So there are some nutrients that, improve immune response. You have vitamin D, you have vitamin E, you have C, you have zinc, and others. Taking up your question directly as to how our nutrition situation is in Ghana, I don't have the figures exactly, but you realize that in relation to children, we have very high levels of child malnutrition in Ghana. When it comes to adults, I don't have the figures directly, but if you go to the rural areas, you realize that nutrition status is compromised. So of course, if your nutrition status is compromised, then that certainly means your immune system is also compromised. So if you get an attack from COVID, then it's going to be very devastating for you. So I think what we need to do is that we need to step up the nutrition education, as the president has been admonishing us, so that people can eat well. We can eat a lot of fruits and vegetables. We can eat a lot of whole grains, so that we can get all the nutrients that are necessary for improving immune response. During the rainy season, again, what is going to happen is that we're going to see flooding in several areas, as Professor Mariwa said. And once there's flooding, of course, there's going to be deficit in food. We're going to see food deficit. Already, you realize that there is spiraling food costs. Food prices have gone very high. So as to whether people are able to buy nutritionally nutrition-rich foods, that is also another question that we can tackle later on in the show. So with the onset of the rains, there are several things that we are going to see, as it relates to the transmission of the disease in our setting here. And of course, nutrition will play a very key role. So if we are not able to get people to get the necessary food to maintain good nutritional status, then of course, it's going to impact on their health tremendously.
Yeah. Dr. Simbedu, if we have to take a look at what the treatment regime was, and then the preventive messages that were coming on, it will mean that we have to make it more holistic at the clinical level, because now, prior to now, it's a frontliners, and so the target had always been the clinicians who were dealing directly with the corona cases. It means that every department is important at the hospital. Is that the case?
So, as it has always been, the case basically has been that all of us are frontliners now, right from the guy who opens the door for you when you enter into the facility, the cleaner at the hospital, the guy who makes the bed at the hospital, the nurse, the orderly, everybody is now a frontline health worker. You have no idea where your next patient or client is coming from. So once contact is being made, everybody in that chain, right from the reception through to the pharmacy, to the consulting room, and all of those places are compromised. And so it is important that we holistically look at the issue of education. A lot of the times, people take it as if it is only those who one interacts with the patient are the ones that are likely to be affected. No. If, let's say, I'm an ambulance driver and I pick a patient from a site and I bring that patient to the hospital, I am equally at risk. I am equally exposed, right? So these tendencies need to be looked at in terms of the holistic approach of the message that all of us are at risk. And it is important that all of us take the necessary precautionary measures to avoid the spread of the COVID-19 pandemic.
Dr. Mariwa, if we look at what the message has been from the World Health Organization, Professor Mariwa, the indication has always been that Africa was going to see a late surge. And if you look at the pattern, it's even been slower But now we're recording cases 200 on a day, 300 on a day, and it shows a certain pattern. What can you deduce from all these data that is being recorded now in relation to the subject of discussion?
All right, thank you very much. And I think the World Health Organization and all related international organizations talking about the fact that Africa is going to have a late surge, I think they are found and are based on the kind of condition that we have in the country, on the continent, especially when it comes to weak health institutions, health infrastructure, in terms of personnel, in terms of logistics, in terms of finance, and also poor environmental conditions that will compromise the immune system of people. And for that matter, if we are thinking of the disease hitting Africa late, then it means that some of these conditions are going to make it worse. And as we are beginning to see, I think initially we were having this kind of poor notion that, oh, it doesn't affect the Black, it doesn't affect African, it doesn't kill people, it doesn't kill the young. And all these fallacies or misconceptions have been eroded. And we are being hit hard because of these underlying conditions you're talking about: poor sanitation infrastructure, poor health infrastructure and financing. And so African leaders should not relax. African leaders should take the bull by the horn and confront the disease head on, understanding the basic conditions that will lead to the surge in the disease conditions and prevalence that we are seeing. And so if you don't understand the basic conditions that are leading to it, I think we will sit there one day and the entire continent will be in a very critical situation. And that is why if you come to some of these issues, for me as a health geographer, understanding it from different perspectives, especially across geographical regions, are very, very important. If we look at our country, for instance, we have hotspots that we need to pay much attention to. We cannot take away Accra, we cannot take away most of our cities that you're talking about. And so what are the basic things that are likely to compromise our immune system, and for that matter, increase the prevalence of the disease? And for me, we have to think of our environmental conditions very, very importantly, because if we are not able to deal with such an important situation, we are going to have a very weakened immune system. And for that matter, we are going to see a lot of people not only contracting the disease, but also dying from it. And these are issues we have to take. Let me give you a typical example. Now, with the outset of the pandemic, we know very well that waste generation has increased. I mean, we are talking about disposable PPEs, nose masks, and all related matters. Even in terms of plastic, because restaurants are not operating sit-ins, people have to do in Ghana what you call takeaway. All these things will increase the generation of plastic and other waste in the country. But we look at it and realize that the capacity of waste management institutions has remained the same. And in some instances, some of the capacities has even been reduced. So if the capacity of most of these companies have reduced because, first of all, they cannot operate as regularly as possible, and with the coming of the rains, their trucks are going to break down. We are also going to have an increase in waste generation. So at the end of the day, we are going to have a very big challenge when it comes to sanitation and waste management and its impact on the health of people, and for that matter, on COVID-19. So all these things came into the reasoning of saying that Africa will be hit hard. And so understanding all these things will help us to deal with the situation right from the word go. And I don't think it is too late. It's not too late to deal with the issue. It's about policymakers, civil society organization, non-governmental organization, academia, the media, everybody putting their hands on deck and understanding some of these challenges and the way forward for it.
Dr. Mega, there was this article that was published is actually a research finding in Forbes, in the Forbes magazine in late April. And it was at the height of all the concerns that the American society had been raising about the infection rates by one Dr. Marshall Shepard. And it gave a certain indication that if you look at a 2012 study in Malaysia, there was a key correlation with bacterial and viral infections and respiratory tract diseases and poor immune systems of citizens. Now, in that sample, they did indicate that in areas where people came from, where rains flashed away, they saw less of viral infections. But in communities where rains were stagnant, mosquitoes were breeding, and other related infections that were recorded, there were relation between bacterial and viral infections. Does that relate to our condition right here in Ghana?
You know, Roland, I think one thing that we need to emphasize is that the way environmental factors, drive disease transmission is at both extremes. You know, for example, increasing temperature will lead to rise in disease transmission, and also decreasing temperature can also lead to a rise or a decrease in disease transmission. So what is instructive to note is that different settings and the way the viruses, whatever bacteria or pathogens play out in those settings. In our settings here, as I indicated earlier, you know, it's expected. We know there's empirical evidence that suggests that, once the temperatures are increasing, then of course, COVID levels are expected to come down. Another thing that we also need to emphasize is that there is also empirical evidence that also suggests that air pollution itself also leads to worsening of COVID situation. And this is because when you're exposed to high levels of air pollution, your lung system is compromised. And ultimately, once your immune system is compromised, whenever you get attacked by COVID, then of course it becomes very severe. But temperature itself and environmental factors, that is weather variables itself, has an impact on air pollution. So for example, as we see onset of rains, we are going to expect air pollution levels to go down, you know. So that will be good for the COVID situation. When there is flooding, as you write it, to come back directly to your question, when there is flooding, of course, we're going to have stagnant water. So if you look at typical diseases which afflict us here, like malaria transmission levels is going to be very, very high. Of course, some of the viruses are going to be flushed out as they saw in their data. But I think what we need to understand here is that we need to understand that once the rains comes in, we are going to have colder temperatures, and that is a condition the viruses need to thrive. You know, but central to all the discussions that we are having here is our immune system. You know, so everything that goes to compromise the immune system, we need to guard against. And that is the reason why I have emphasized that we need to improve our nutrition. And it was very refreshing to hear the president himself admonishing us that we need to eat well so that our immune system can be up there. You know, the things that Professor Mariwa has been highlighting is also very crucial. That if we have high levels of environmental diseases, that is diseases that are emanating from poor environmental sanitation, of course, your immune system will have to fight it. And then once you have a compromised immune system, then of course, if COVID attacks you, then it's the same thing. You started the show by indicating a new finding which has just been published by some researchers from the UK, that dexamethasone is now a major breakthrough for fighting the COVID infection. And what they found is that those who have severe cases of COVID, when you put them on the dexamethasone, it's going to reduce mortality rates among them. And we know dexamethasone is an immune suppressor. So what you don't want is that you don't want the immune system to be competing. And that is the more reason why when you have severe COVID, already your immune system is fighting. So they need to suppress the system. I'm sure Dr. Asian might tell us more about that. They need to have a drug that will suppress the system, and then you can have relief from the virus.
Yeah, because indeed, I was just about to ask about the dexamethasone. Because if you take a look at what the reports are saying, emanating from the UK, it cuts mortality. It really doesn't give you very much high curative figures in the first place. Now, we naturally, Dr. Siembedu, have a population, and if you segment the population very well, a certain section or minute sections, especially based in the south, tend to eat very well, and the larger in the outskirts of the southern belt, and then the middle and northern belt just don't have the right of sort of nutritional levels. At the clinical level, how does some of these things become useful in treatment in the first place, the new drugs and our situation?
So, as has been rightly said, I think that this drug is promising, but again, it may also have some shortfalls in terms of its use. In terms of our geographical location, dietary requirements, and how it helps our immune system, I think that there's at least a fair balance between what is grown in each locality and how variations of that helps to boost our immune system, right? And so it will be important to localize in terms of the nutritional requirements of what people need per specific locality, so that they can have access to readily available nutritional foods that can help boost their immune system. One of the things that we haven't mentioned again is the lack of vitamin D, which is also a huge consequence when it comes to building up of the immune system and how it would help you to fight off infections and all of that. In this rainy season, we are going to see a lot more people becoming deficient because you can go out there and get the natural vitamin D, and so you may have to rely on food sources that would be able to provide you with enough vitamin D so that you can help fight the infection. But largely, as we have said, I think that the whole discussion is centered on making sure that if there are any other things that are likely to compromise our immunity, if there are any other things that are likely to lower our immune system so that it wouldn't be competent enough to fight the infections, these are things that we should focus on. And one of them is the insanitary conditions we find ourselves in. So that whilst we grapple with the rainy season, the attendant usual cholera, diarrhea, and all the other seasonal diseases that comes during the rainy season, it will be important for us to also focus on helping to reduce the burden of those diseases whilst we look at appropriate nutritional interventions that are properly localized within different settings to help people fight off the infection.
Oh, very important there that you made mention of that, because this very drug is already being used for some level of treatment in arthritis, etc. And so ultimately it means that we need to complement that with what already we have in our system. That's what we're saying, Dr. Kofi Amaga. Please unmute your sound and start again. Unmute your sound. Your sound is muted, Dr.
Yeah,
Kofi.
so sorry about that. So the drug is not really for cutting back on infection. So this drug is for treatment. And it's not for treating mild cases. It's for treating severe cases. So those who have been intubated, they've been put on ventilators. Those who have been given oxygen, those are the severe cases. So once you have a severe case, then this drug will be able to cut mortality by 20%. And this is from a very rigorous epidemiological study design, randomized control trial, which recruited about 2,500 people. So it's a very large study. That is the gold standard for medical practice, for evidence for medical practice. So it's very promising. And from what I read, the UK Food and Drugs Board has recommended it for treatment, So maybe it's something we can also consider here. But fortunately, in our settings here, we don't have severe cases. There are very limited people that are being on ventilators and they've been given oxygen. But, let me add up to what Professor Mariwa said in terms of when you raise the question whether there will be a surge in Africa. It could be, but I'm very skeptical. The reason why I'm skeptical is that, you see, over the years, we have built immunity to infectious diseases in our settings here. we have been afflicted by malaria, we have been afflicted by tuberculosis, we have been afflicted by HIV and several infectious diseases. So naturally, we have built immunity to infectious diseases. You know, you go to Kotokraba market, you're going to see a 2-year-old child crawling on the floor with all the infections. So over the years, this child is going to build immunity. What disease can kill this child? You know, so we have built immunity. Again, you know, we are vaccinated. There's a lot of speculation and hypothesis which remains untested. I mean, BCG vaccination, for example, has been linked with trying to cut back on COVID infection. Yeah. And over here, when you are giving birth to, you are giving BCG vaccination. So, and again, we also have, some people have also built immunity against malaria. So, for example, let's say if for 2 years running, you have never been attacked by malaria, then that means that you have immunity against malaria. And there's also speculation that once you have immunity against malaria, that can also cut back on COVID-19 infection. So even though the WHO is projecting that there will be a surge, and it's based on what Professor Mariwa said, that because we have very weak health systems, so the moment levels start to go up, we are going to be overstretched. I'm very skeptical. I think the masses have built immunity against infectious diseases, and I'm not sure we're going to see the levels that we are seeing in Europe and North America. But we also need to take advantage of some of the new drugs that are being proposed, like dexamethasone, so that, I mean, if we have very severe cases, why not? We can recommend them for use here. Yeah.
Professor Mariwa, from all these analysis that has been made by all of you, Africa and the way we live in our country, because of the tropical nature of weather and the number of cases that we tend to see of normal tropical diseases at OPDs, we seem to have built our heights very well, quite strong, inherent in us. At what point would you advise that we don't have to think it's all over and so the population is immune in many respects?
All right, thank you very much, Roland. If you look at the argument so far, we want to, I think when it all started, there was this kind of argument that it doesn't affect, I mean, with high temperatures, you're going to have it. But now we know that high temperatures are there. We are in tropical region, and for that matter, we are not so much worried about it. But now we see that something else is also happening. So I don't want us to be so comfortable with ourselves and thinking that everything is well and nothing is going to happen to us. But we have seen, got evidence when it started. In Ghana, as of March 12, we had only 2 cases, but now we are more than 12,000 cases, and the number of deaths has moved far beyond 50 as within the shortest possible time. And so for me, it gives me a source of worry to look at the kind of conditions that we have in the country. I think you made a point that we have vast spatial variation in our development. If you look at down south in terms of health facilities, most of them are concentrated in down south. If you look at road facility, road network, good road network, all the good things are concentrated in the south. And for that matter, the northern part of the country have been neglected for a very long time. And my worry here is that when such diseases hit those areas, it's going to be very, very, very serious. And so if you are thinking about it from individual point of view, even though we are getting so much worry or very comfortable of a Ghanaian or an African child building such immunities, but we are still having situations where malaria is killing us more often. We also have situations where in our part of the world and different parts, even within the country, we have different situations where people go to the hospital with strong, common, preventable diseases. So I want us to appreciate the fact that the conditions that we have makes us very, very weak in terms of how we can deal with the disease, especially as we have spatial variation in the levels of development and how we did. Let me give you a typical example. In Accra, Greater Accra region, we have only about 7% of the people who are doing, or 11% of people practicing open defecation. The situation is high. When you go to Upper West, Upper East, we are talking about more than 50% of the people practicing open defecation. And so if such situations happen over there, and we know that with the opening of the Bagre Dam in Burkina Faso, we are going to have flooded areas in the north. And when we have flooding, and with open defecation so high, you know that the cholera cases, the diarrhea cases, especially for children under 5. And here we should appreciate that when we are not able to deal and get some of these issues right, we are going to have a big challenge. And I think that we cannot move people, even those at the south, when we are faced with health challenges, we are finding it difficult to look. And now even the hospitals are no more safe for people in terms of COVID-19. So what happens? So we should begin to get this understanding and see how best as a nation we invest in this infrastructure, we prevent people from getting some of these basic diseases that we can prevent. And so we shouldn't be so comfortable. For me, unless we see a lot of interventions, a lot of situations where we have cases coming down on consistent basis, we should not be sitting down. If you look at it from a broad perspective, I can see that hand washing, which has been prescribed as very, very important. Now, if you go to most facilities, people do not insist on hand washing. You can see some even don't have functional hand washing facilities in their location. So people are easing on the way people are washing their hands. And once we ease on that, I think there's a challenge because most Ghanaians are beginning to feel so comfortable that, oh, now nothing is happening. And when we take round, and anytime I go around, I get worried, Roland, because the speed with which people were procuring issues of functional hand sanitizer, hand washing facilities like Veronica bucket, tippy tabs, with all the things that you need. Now you go to a place, either the soap is not available or there are no tissues to clean your hands. And so for me, those facilities are becoming a source of contamination and a source of worry for me as an individual who is interested in ensuring that some of these basic preventable health issues are dealt with. And so from suggestion point of view, we should intensify the education on hand washing, face masks as we are wearing them and all that. But we should also understand that beyond all these interventions, we need to put better infrastructure in place and invest in that so that next pandemic, I know this is not going to be the last one. A number of them are going to happen, even if not in our lifetime, it's going to happen several years to come. And for that matter, if you're able to build our health system so right, you'll be able to deal with some of these basic challenges that we are facing within the country.
Okay, in a minute each, Dr. Esiembedu and Dr. Kofi Amega, what are the words and cautions would you will leave us with? I start with Dr. Esiembedu.
So, Roland, I think that we need to let policymakers know that the season in which we are, which is the rainy season, is a very crucial one for us. This is a time we need to get our tactics right in making sure that we minimize unsanitary related diseases so that we don't have a lot more people visiting the hospitals. We don't have a lot more people becoming sick and thereby becoming exposed to other infections that could include the COVID-19. So it is important that we up our game in terms of how we manage our waste, how we manage our environment to minimize the spread of the known unsanitary related diseases so that we can reduce the burden and the risk of contracting COVID-19.
And Dr. Kofi Amega.
Yeah, Roland, I think my final words are just twofold. Central to preventing the spread of COVID-19 is improved hand washing. Hand washing under running water with soap. COVID-19 will be a thing of the past. But I think one legacy that COVID-19 will leave with us as Africans is that it will leave with us improved hand washing practices. When I walk around Ghana, in spite of the fact that there are some limitations in several other places where, as Professor Mariwa rightly pointed out, that you might not see tippy taps, you might not see Veronica buckets, and largely, I would say about 60–70% hand washing practices have improved. If you look at the proportion for sub-Saharan Africa, hand washing under soap, it's I think about 15–20%. So if we are doing 60–70%, that is impressive. And it means COVID-19 has been very, very helpful. So I think that is one legacy that COVID-19 will leave with us as Africans. The other thing is that I want to emphasize, I will not leave here without talking about air pollution and its link with COVID-19, because there is emerging evidence that suggests that air pollution is linked with transmission of COVID-19 through compromised immune system. Again, if you look in our settings here, we have about 70% of the population using charcoal firewood to cook and generating a lot of smoke in the household, especially mothers who cook for us, you and I, for us to eat every day. And when they are doing this cooking, they have their young children at the back. So they are all inhaling this smoke and their lungs is compromised. And once you have a very compromised respiratory system, immediately you get attacked by COVID-19, you are on a tangent to dying. So again, COVID-19 is also another opportunity for government to ensure that we have equitable access to clean cooking solutions. That means we have LPGs all over the corners so that mothers and domestic users don't have to resort to wood and charcoal burning, whereby their immune system, their lung system will be compromised. And when they get afflicted, not only COVID-19, but any respiratory illness, they will be on the tangent to dying. So those are the two things that I will leave with the audience, I will leave with the population, that COVID-19 is not a good thing, but one legacy we will leave with us is that we are going to see improved hand washing practices going forward as a country and as a continent.
Well, you guys are one great house of a store of knowledge. We need to put you in one research facility or institute. I mean, it's been great knowledge sharing, and I'm hoping that our audiences and viewers variedly across all sections of the demographics are also well educated. Samuel Esembedu is with the University of Cape Coast and is a microbiologist and immunologist, and Dr. Kofi Amega as well is well versed in his fields, and you have to tell us more when it comes to air pollution and its impact in our society. We'll come back to you on that. And Professor Simon Mariwa, also grade 1. I have my director, Yao Forsen, this morning, who says he was your student. And, well, you've had many students across the spectrum, so I'm not sure that you remember all of them. But that's a good one. Keep training all of us. We have to go to the Electoral Commission. Dr. Bosman Asare is a deputy chair of the Electoral Commission of Ghana. It's all election matters, speaking with Mamavi Owusu Abuaje. And I tell you, great education, but also great introspection that we need to do next, live from the Electoral Commission on the AM show.